Good afternoon. Thank you for being here. Thank you for the folks that are online. So my name is Claudia. I'm in the OIP program. I'm going to present today on firefighters' health. So about maybe 1 year ago, when I saw these pictures and when I thought about firefighters, the things that came to my mind were, yeah, hoses, yeah, water, yeah, fires. But that was it. I did not put much thought into that. Now, my lab, we've had the opportunity to work with firefighters in a research project, and that has changed completely my perspective. So now what comes to my mind whenever I see pictures like this, I'm starting thinking, oh, the chemical hazards, and oh, are they wearing their SCBAs? Or oh my God, oh no, if they're only relying on PPE, that's not the way to go because they're hierarchical control. So a lot of other things come to my mind now, and I'm very thankful for that. So in our line of work in occupational health and safe, our main goal would be to get the workers back to their home safe, right? But now we also have to think about the possibility of them dying. And when it comes to firefighters, the number one cause of on-duty fatalities are sudden cardiac death. That basically means that the heart, for some reason, stops just pumping the blood. The usual reason is due to electrical malfunction in the heart, and that's commonly caused by cardiovascular disease. And on-duty fatalities, that means that they could die when they're on the job, but there has been a change of that on that. Because before it was just while they were like on their shift, but now it has been extended to up to 24 hours after they finish their shift. Now, the article I'm going to present on, the one is the cardiovascular disease risk factors in career firefighters, 6-year follow-up study. What comes to my mind when I see this are two things. One, risk factors, but the first thing I start thinking, oh, so they're going to do associations, they're going to be prospective cohort studies. Also, when I see 6-year follow-up, so my mind is, I'm going to read about a prospective cohort study. What's their objective? Investigate the evolution of cardiovascular disease factors in career firefighters. So we know they have a high prevalence, but what happens years after? 1, 2, 3, in their case, 6 years. That's what they wanted to look into. So they did a questionnaire, in career firefighters. When I read career firefighters, at first that meant nothing to me. But now I see that, oh, so their career, are there any more categories? Yes. So they are volunteer firefighters, they are paid per call, they're also military firefighters. But for our study, they focused on career firefighters. What did they do? So this took place in Quebec, and it turns out that there are around 5,500 career firefighters. So they sent out via email an invitation in November and December 2015, and out of those, 11% said, yes, I'll do it. So they have an 11% response rate. From those 552, just 38% of those actually left their info for a follow-up, right? And out of the ones that left their info, when they actually contact them again in 2021, only 96 responded. So we can see our final end is 96. And if we look at this in total, they had a 1.7% response rate. What did they look into, or what did the questionnaire imply? So they asked about demographic, age, gender, anthropometric information, the occupation, the place where they were in, and regarding the presence of CVD risk factors, they asked about obesity, hypertension, diabetes, dyslipidemia, smoking status, and physical inactivity. What did they get? If you look at the article, it's a long table, it's table 2, but I'm not going to go through all of that. So I'm going to focus on the ones that were statistically significant. This does not mean that the ones that were not, they are of no importance to us. No, but I have to focus on something for this. So let's focus on this one. We're going to go for the p-value. And it turns out that age, body weight, BMI, smoking, a number of CVD risk factors were the ones that were statistically significant when they made their comparison between 2015 and 2021. Now, I want to bring your attention to the kind of test that they used. You see dependency test and per proportion test. One of the questions I had when I read it was, okay, so they said they sent 2 questionnaires. Did they send the same questionnaire? Did they send a different questionnaire? And I inferred that the answer was the same because of the test that they used, the dependency test and per proportion test. One of the limitations that they said was that they were not able to compare the 96 people to the rest of the firefighters. So what they try to do with that, so they compared the one that answered the follow-up and the one that did not answer the follow-up. So again, I'm going to present, the table is longer, but I'm just going to present on the one that were statistically significant. That will be age and number of CVD risk factors. In this case, we can notice that they're using different types of statistical tests to run the comparisons. Independent, t-test, and manually. That has to do because the fact that now they're comparing different groups and they're working with the same one. Okay. What's the conclusion for this? The conclusion is that when it comes to the evolution of the risk factors, that's what they wanted to do. They had a weight gain of 0.2 plus minus 0.9 kilograms per year, and there was an increase in the number of cardiovascular disease risk factors. That is what they got. Now, some things were brought to my attention, and that's what I want to talk to you guys about. When you see the title, the first thing I thought was prospective cohort study. So I was expected to see some risk estimates, some associations, something else, because I think that when you have a longitudinal study, it's a very good way to get more information. So I asked ChatGPT if this was really a prospective or not, because I was also struggling with finding the exposure, the outcomes not so much, but the exposure. I'm like, okay, so what's the exposure? Being a career firefighter? No. This is the answer I got from ChatGPT. So it said that it was a prospective cohort study. So I kept on asking, like, hey, well, I'm having troubles finding out the exposure. Turns out I got that the exposure was the passage of time. That's why it said that it was. I had not read yet until I saw this one. Exposure being a time being used as an exposure, and the outcome was the change in the CVD risk factor. So I kept on asking, but it was still not clear to me if this was really a prospective cohort study or not. And this is the answer that I got. So it turns out that it's a prospective cohort study, but in a descriptive way, not looking for associations. So I asked why. Why had they not run associations? I said, well, that was beyond the objective of the study. So I kind of agree with that. Like, they wanted to see the change, so that's what they got to do. They saw the change, but nothing else. The methods that they used were not used for modeling. All the ones that I told you, the t-test, the Mann-Whitney, they are not used to create associations. You stated that the exposure bias was time, and maybe one of the reasons is that their sample size was very small. They would not be able to run those possible associations. That is what I got. But what are your thoughts on that? What do you feel? Do you agree? Do you disagree? How would you call? Would you see another exposure in here?
So all 96 of them stayed firefighters throughout the 6 years.
Correct. Yes.
Did they look into any of the non-responders that didn't follow up after 6 years and see if anything happened to them?
What do you mean by anything happened to them?
Like what? They stopped being firefighters? Did they die?
Oh, no, they did not come to see if anything. They just got the data from what they actually answered and tried to make comparisons. Mm-hmm. Yes.
This doesn't seem like a prospective cohort, but more of like a cross-sectional study that had a twinge of follow-up to it. So I think.
Very kind of you.
I'm trying to be generous.
I know.
So yeah, I don't.
Yeah, it doesn't feel like a
rough to use.
prospective cohort study. Yeah.
Because it's not.
Thank you, Dr. Yes, Dr. Heckman.
Very liberally, some people would call it obviously a prospective cohort study, but if you look at what Dr. Thies would teach, I think he'd be teaching you need to identify a population, do careful follow-ups over a period of time. This is a lot closer to serial cross-sectional studies.
Yes.
I would classify as a longitudinal study. So since Dr. Thies is not here, then give us his wisdom. I'm pretty confident, however, this is not an example of a prospective. I would raise a question for folks. What do they think about the number 96?
What was the question?
96. What do you think of the number 96?
It's a small sample.
That's a really big drop.
What do you think the overall participation is? This is in where?
Quebec.
How big is it? How many people? How many firefighters? Any guesses?
Sure.
Is
Career
it,
firefighters this number.
is it Montreal?
And the response rate total was this one, 1.7%.
So Montreal, also in Quebec, has a fire department that has over 1,000 firefighters in it. I think they actually have quite a bit more than that. I haven't worked with them in a while, but regardless, if this is by no means a representative sample of firefighters in Quebec. So
How would you try to prove or disprove that, what Dr. Allen just said?
That there is not representation,
That it is or is not representative?
or just by the response rate.
More than that. Usually there's some other data available somewhere, right? There's some sort of population-based data available that report and there are numbers online. I don't know about the demographics, but at least looking at least the basic demographics to see if the responders look like the substrate population.
yeah, there's a Canadian equivalent of the Bureau of Labor Statistics. So you can find out what is the distribution of firefighters in the various provinces. You can look at what their demographic characteristics are, et cetera, and you can map that onto this 96 person sample and verify and see how close are we to looking like what the population of firefighters in that province, right? And with that information, then you can start to at least infer, are we representative or are we not? At this point, I'm guessing not.
Yeah.
But they didn't, I haven't, we'd have to look at that data and present that with this. So, yeah. That's one way to try and get towards arguing for representation. If they thought of that, they probably looked at it and then decided not to present it because it didn't help their case. That's my guess. If they thought to look.
That's beyond a faux pas, in my opinion.
Yeah.
Because if you're trying to obfuscate the truth. Excuse me, what is your role in science? What is your ethical obligation? You know that the population is not representative and you don't say it's not representative. I have major problems with the heat zone. So I'm gonna trust that they actually didn't know. I'd rather think well of them.
Other comments? Yes, okay.
I know it was beyond the scope of the study, but there's a whole lot of other factors, psychosocial factors that I'm particularly interested in, so I do apologize for my own bias, that are not included in the study. And that's okay. I mean, again, research studies are not gonna all do the same things, and that's perfectly fine. But the absence of those, begs the question, so they show relationships even in this sample that we've already kind of poked holes in, between BMI and physical activity and various factors that are affected by the behaviors of the folks in the department. So we know historically speaking, firefighters are not the best when it comes to diet, and exercise. And that continues to be a problem and varies by location. Some locations they'll have exercise equipment there and they'll have a dietitian who's preparing the meals and so forth. And others will have the KFC down the street and the football game. And that's their idea of diet and exercise, right? And because of that, you're gonna see wildly different cardiovascular, outcomes for those different kinds of groups. So it's one of those things where those choices aren't part of this model. But if I wanted to understand cardiovascular disease in the fire service, I would want to understand a lot of other factors that are contributing to that and how they vary department to department, from region to region and so forth.
You
Well,
have an
and
idea
even
of these data look like Utah data or Western Utah? None's in the table.
Which the
Table one.
oh, I don't have all of it, but
It's below that. If you look at the physical activity, their numbers are marked for 60 to 67%. It's
Enough.
that it's not; those are not UTI
Yeah.
data.
Yep.
Our exercise numbers would be the inverse, probably.
But also departments in Utah, at least in the metropolitan areas, often have equipment for, physical activity type, weights and treadmills and various things like that, and also access to places where they could get more physically active. Whereas we don't know enough about this sample to know what the nature of their departments are like. We do know we've got regular firefighters and lieutenants, captains, and officer chiefs, but I don't know if we know whether we have career or volunteer, or some mix of that. Did they say that anywhere?
Yes, it was only with career firefighters.
Okay, so it's career firefighters. So career firefighters usually will have more resources, but if you start talking about volunteers,
Yes, different story.
they have their own day job. And then they also, like, Senator, was it, that was here the other day, who's a volunteer fire, department guy.
Representative Snyder.
Yeah, Representative Snyder. He's, he has a day job and then he's also a volunteer fire person. And so obviously that's a different dynamic, but they're also exposed to similar things. And if they may be on call and living in the station during a period of time, and they're probably not engaging in the same kinds of career, design policies and practices that the career folks are. So.
Yeah.
Interesting things.
My question is more directed at Dr. Hagman in the sense of pointing out that high rate or high prevalence of inactivity would indicate some response bias. What do you think this is like, this population is representative of? What would that potentially, like, people that are more senior in fire departments are responding to this, or?
Well, so yes, I do have that concern. I don't know their structure of their force, but if you look at table 1, it's only got 47% are, well, I call them regular firefighters, but that's, for us, that's firefighter, EMT, firefighter, paramedic type folks, and I think our structure is not that. I think we've got more of a pyramid, from my impression. I don't have numbers, so I do have a concern that there's a little bit of a weighting towards the physically inactive because of getting older people. But that's not gonna come with that, right?
Any other comments?
So Dr. Allen pointed out one important thing, which is equipment. I'll tell you that a lot of the gyms and stuff are fabulous. You need more than 30. Yeah, so there's lots of students that also have. That's their collection. And what else?
For people to actually either do it or maybe time to do it.
Time is one thing, yeah, but there's another bigger factor. My
Willingness.
getting there. The culture.
Yep.
It's a social culture. And what we have here are guys who are somewhat competing against each other. And in the fitness realm, it's mostly a good thing. There's a little way too much testosterone. It's a subject for another day. But that's what you have is cultural things going on.
Yep.
Therefore, writers are dang fit. BMI is 20 to most low 30s.
Yep.
And a lot of muscle.
Yep.
Ryan Olson online said, not sure if diet has been addressed, but firefighters eat together and do not always have the healthiest of diets, low fruit and vegetables, high fat, etc.
Yep. Yeah, we mentioned that, Ryan, and you're exactly on point there, that they'll often say, well, this is a man's meal today. Having been in a bunch of fire departments and ate meals with them, I usually make sure that in the morning I have a protein shake, in the evening I'm planning on a salad, because if I'm having lunch with them, I know that's all the protein and fat and carbohydrates I'm gonna need for a week. So,
Yeah, Diane Elliott and colleagues at OHSU did over a decade of research with firefighters, and
Yeah.
the public perception of firefighters as being very fit and active is not necessarily accurate. And so even physical activity levels are not necessarily super high.
Yeah, the physical activity, Ryan, the physical activity levels here in Utah are high. But
That's great.
yeah, it is great, but you're right on the money about the fruit and vegetables thing. And I will tell you, we've done now 32 firefighter cancer screens, and the common you're supposed to be eating 4 to 5 cups of vegetables a day.
they're getting 1 to 2, maybe 2 to 3.
That's exactly right.
Yeah.
Joe just hit it. That's where they are. Most of them are.
That doesn't surprise me at all.
It's rare for somebody to put more than 2 on it.
Yep.
I mean, how does that compare with the general population though? Because I would also guess that the broader population is eating less than 1 or 2 cups of vegetables per day as well.
I haven't looked at anything,
Yeah.
but
General population is about a little over 3 servings on average last time I checked.
What happens if you factor in rural populations?
Rural population, yeah, so the interesting thing about this is that they're very different from different populations, different areas where you've got small town fire departments where you may, it's volunteer, they're gonna have a different, slightly different kind of makeup and so forth. So there are trends, but yeah, you have to take those into consideration. And obviously with this article, that wasn't the goal or that possible, but when I think about the firefighter cancer initiative and how that grows and expands over time, as we start considering rural departments, even in Utah, how does that differ from, the more urban settings? And then if it ever goes beyond that, if Colorado or others decide they want to do something like this, what does that look like? And how do risk factors, not only for cardiovascular disease, but also cancer, going upstream to the diet, to the exercise, to culture, as Kurt was mentioning earlier, are all going to be factors to, increase prevention. Fun stuff.
I also feel like I always talk about sleep, so this is probably like you could guess, but I really wish they measured sleep somehow because we know it's a huge factor in CBD. So I don't
Yes,
know.
for
That's
sure.
an oversight in my opinion too.
Agreed.
Exoskeletons.
thank you.
Wi-Fi in and out a lot. Oh, okay.
Can you hear me? Right? Good enough?
Say, go up, yeah.
Go up?
Yeah.
I want to be yelling at people on Zoom. All right. Awesome. Okay, my name's Chapman. I am presenting an article that looks at the relationship of vicarious trauma in lawyers and mental health professionals. So there's not a whole lot of research on vicarious trauma as a concept in general, but for the purposes of my dissertation, this is one of the few articles that looks at vicarious trauma in lawyers specifically. So I thought it was interesting to present on today. Okay, so to give a little bit of background on just an overview of vicarious trauma, it was introduced in the 90s to describe the impact of being exposed to other individuals' traumatic experiences, whether that's through listening to client stories or being exposed to potentially traumatic material like photos, videos.
And it is defined as like fundamental change in the cognitive schemas, emotional states, and spiritual or belief structures of the individuals that are exposed. And it has been defined to be different from other disorders such as post-traumatic stress disorder or burnout. So it's its own thing. That's a much longer conversation than what's needed to understand for this article, but it has been demonstrated primarily in helping professions such as mental health professionals, first responders, healthcare personnel, and some research has shown it in lawyers as well. So the purpose of this specific study was to compare two different occupational groups together in their rates of vicarious trauma, and then do some secondary analyses to look at some predictors of vicarious trauma and specifically looking at personality, which is a pretty novel approach. And then this was done with a cross-sectional study design. So we'll get to go into a lot about later about the nature of this design and the study population or the sample size, because there's definitely some weaknesses in the study. But to go into the participants, they were lawyers and mental health professionals. So mental health professionals were made up of psychologists and social workers. And they were both groups of individuals were recruited from respective professional organizations. So it was legal aid offices or private legal centers for lawyers, and then the Australian Psychological Association, I believe, for the mental health professionals. And they stated their recruitment methodology was pretty slim in the article, but they did say something to the effect of these were people that were working with traumatized clients. So I don't know if they tried to figure out ahead of time that these individuals were exposed and maybe not representative of the whole population or to begin with, but they were trying to identify individuals that were more likely to have a vicarious trauma exposure. But they kind of alluded to that. And then a recruitment email was sent out to the individuals that they were interested in having complete the survey. There's no information on response rates in this article. And individuals were invited to participate in an online survey. And they excluded anybody that only partially filled out the questionnaire. So for measures that they used to make some of these analyses, they used the vicarious trauma scale, the impact of events scale, the 10-item personality inventory, and depression, anxiety, and stress scale. So a lot of these are the validated measures for are versions of validated measures for the respective outcomes that they're looking at. But the important one to look at, or that for my world, is the vicarious trauma scale. It was designed in 2008, and right now, because the field or the idea of vicarious trauma is pretty new and understudied, there's not a lot of great ways to necessarily diagnose or identify vicarious trauma, and this is probably the most used tool to identify either secondary trauma or vicarious trauma in any population. So it was great to see that they actually use this, because in a lot of studies, it's still being identified just by asking point blank questions instead of using some form of a scale. And then the analysis that they ran was taking, a lot of it was done with independent sample t-tests, looking at the group differences between the lawyers and mental health professionals. And so that was done along simple sample demographics, their total VTS scores. So that would be like the main outcome, the primary outcome would be the group differences between lawyers and mental health professionals on the VTS. And then they looked at specific items of the VTS, and then they were, another interesting aspect was looking at group differences of the items from the DAS, the drug and alcohol, and drug anxiety and stress scale amongst those two populations, and the personality traits. So though that was like I would say, primary analyses that they conducted. And then they also looked at how the big five personality traits correlated to the outcomes of vicarious trauma and the impact of event scale scores. And then they did a very basic regression analysis for predictors for vicarious trauma, which we'll get into later. But the main outcome was that vicarious trauma scores, or the vicarious traumatization scale scores, were higher on average in the lawyer population than the mental health professions. And as it has mostly been demonstrated in professions like mental health professionals, it's alarming to see that lawyers are experiencing this at an even worse prevalence than mental health professionals. And then the lawyers, to me, unsurprisingly, but interestingly, were significantly higher in depression, anxiety, and stress, according to this sample from their DAS scores. And then some secondary outcomes was the strongest or the most related personality trait was emotional stability. So low emotional stability is also related to high neuroticism. And this was related to both the vicarious trauma scale and the impact of events scale. And basically, it suggests that individuals who score low on emotional stability, or in turn score high on neuroticism, have higher levels of vicarious trauma. And then conscientiousness and openness to experience were also negatively correlated to the vicarious trauma scale, but just that one, not the IES. And then kind of an interesting thing from their regression model, they were trying to predict, there's not a lot of information on it, but they were trying to predict the outcome of vicarious trauma. And they attributed 15% of the variance in vicarious traumatization symptoms to their profession. And then they also showed that there was a significant relationship to the intrusive elements of a traumatic history past. But we don't have a lot of information on, or virtually no information on, how they actually gathered that information, just that to some effect, individuals who had intrusive thoughts and history of personal trauma were more likely to have vicarious trauma. This is in line with some other research that's done on vicarious traumatization. So it's not surprising, but the methods were a little vague at best. So getting into some of the strengths and weaknesses, this was an important study for me because there's just not a lot of information out there on this. So it's hard to be like excited about the findings because there's a lot to complain about here, but it does address an underexplored population of lawyers in vicarious traumatization, and it uses these validated measures. And then also kind of bringing in some of these personality traits to it is something that hasn't been done in virtually any vicarious traumatization research. So that was also interesting. And then getting more into the weaknesses, the cross-sectional study design is, it's not great, but also it doesn't necessarily have to be a weakness. It's just, there's no temporality there, so you can't make any causal inferences. Not that you would with this sample size or methodology to begin with, but the self-reported data is also pretty limiting, and the fact that we don't know the response rate or anything like that, the potential selection bias could lead to all sorts of information and systematic errors within this data collection. And then the small sample size might not necessarily be probably is not representative of lawyers or mental health professionals as a whole, because only got 30 some per group. And they really didn't adjust for anything. Through these method of analyses, it's kind of hard to adjust for stuff, but even in their regression modeling, they didn't mention any like adjustment for variables. So that was also pretty bare bones. I did a couple things with ChatGPT that I thought was interesting. I asked what it thought the limitations were of the study, and it was pretty much in line with like what you would expect someone like Dr. Dietz to say about a study like this, which is kind of cool. I have it up here, and then I later asked it a question that I can show after we have a discussion. But I asked it about like what it thought about drawing conclusions from this study. So I figured I could pull that up after we have a conversation about it. But getting into the discussion, this study basically is just suggesting that vicarious traumatization is something of importance to look at in lawyers, that they're potentially vulnerable to it, and that it reinforces some other literature that focuses on lawyers, that there are problems of depression, anxiety, and stress within this population. And it brought to light some new aspects of it, with the idea of emotional stability being a potential risk factor for increased rates of vicarious traumatization. And it highlights an ability to hopefully help these populations in a new way through those personality traits, and just what we could consider as like protective resilience factors from a preventative standpoint. So future research, there's all sorts of things that can be done, but one of the things that I'm hoping to do through my research is investigate the impact of vicarious trauma on at-risk populations. So my project is focusing on lawyers specifically, and we're looking at treating vicarious trauma more as an exposure rather than just an outcome. But there's all sorts of more research, because it's so bare bones. Even defining vicarious traumatization could probably have more research put into it. But getting into the discussion questions, how might these selection biases and reporting biases have influence on the results?
So,
Darn it.
because it's I think there's response bias in the sense that like anybody who's willing to volunteer their time, that might generally be in like a better mental state than someone who's like, I don't have the mental capacity to like respond to the study or whatever.
Especially with lawyers being like time-billing people that.
It almost sounded like the people they emailed to recruit were cherry-picked, or what were the inclusion criteria for actually reaching out to them?
That, I think I could probably read it to you because it's such a short section, which is alarming. But yeah, the language seemed like there was definitely a little bit of a cherry picking going on. Potentially. It was kind of vague, so it's hard to know.
On that note, what is the participation rate overall?
You could, in theory, maybe find out for the psychologists because of the Australian Psychological Association, but
We'll be on par with Claudia's excellent presentation, prior one. 1%, be that.
it easily could be.
So one concern that you put in a strength is the measures being validated. The TIPI 10-item personality inventory is typically recommended if a corporation wanted to measure personality and they wanted to put it on their pulse survey. I give them the TIPI because if I gave them the measure that would actually do a good job, they wouldn't do it. But the TIPI at least uses items from the good measure. And they had Cronbach's alphas as low as 0.45, which would never get published in a psychology journal, like, except for this says psychology on it, so I don't know anymore. So there wasn't, you said there's only one of the scales was related to both of the outcomes,
Mhm.
right? Probably that one had an internal consistency that was actually reasonable enough to be able to do it,
Okay.
right?
Yeah.
And so really that measure of personality is not great. You need to have alpha coefficients above 0.7 to be really actually considered okay. Not great, but okay. And so that measure would not be considered a good measure for research.
Would you say this is plausible? Like there's biological plausibility to what it's saying about emotional stability?
Yeah,
I'm just curious.
yeah. So despite it being a terrible measure, some of the correlations that are shown there probably are real. But whether they're higher or lower than that, and whether there should be relationships between like extroversion and because extroversion tends to be one of the ones that gets to 0.45 on a 2-item scale. That's a problem, right? And so they have slightly longer versions of that same scale that take more than what they say. It's only a 2-minute scale. It's like, yeah, that's not something to be, or 1 minute. That's not something to be proud of necessarily when measuring something that you want to care about. But yeah, there's other measures that are not much longer, maybe 3 minutes, 4 minutes to take, that would have gotten the internal consistency better, and therefore likely measured what they were supposed to measure better. And you'd see more relationships and more accurate relationships on these variables, and I'm guessing several more of them would be significant.
Would that be like the Myers-Briggs?
Definitely not the Myers-Briggs.
Sorry, I'm trying to remember
That's
that.
that's another garbage measure of personality. I know Matt Hughes will disagree with me. Myers-Briggs has a very good marketing and consulting shop. That's why it's used by everybody, not because it's actually a good psychometrically valid scale.
So what would you suggest?
I would use the IPIP 50 or the IPIP 100.
IPIP?
Yeah, I think this is probably either an early version or a knockoff of that same scale that has a 10-item version that, like I said, I would give I would give that to someone over the Myers-Briggs.
Okay.
And I would use I think there's a 50-item, and there's a 50-item and a 100-item version. Either one would be a much better scale for this. Yeah, and I know that wasn't like their main thrust.
Yeah.
But because they were so excited about it,
They were very excited about
I was kind of like, come on, guys. This is not actually something to be too excited about.
Yeah. Well, I thought, I mean, it was exciting for me because this was a topic of interest for my committee.
Yeah. Are you using the personality scale on your dissertation? Okay. Because if you are, don't use that.
No, we're not.
We'll help you find one that's good, but anyway.
Okay, I have a clarification question and then a
Okay.
totally separate thought. In the discussion, they say that both lawyers and the MHPs scored in the moderate range for affective and cognitive symptoms on the VTS. So are there dimensions on the VTS? Or like subscales?
Vaguely, like they're more like, because vicarious trauma is still kind of being defined better. The people that designed it believe that there are subscales within it, but I would argue that probably not the best at actually assessing that,
Yeah.
or maybe not like well defined yet.
Yeah, someone's got to do a confirmatory factor analysis for sure. Okay, my other thought is, how do you think like self-selection into professions where you know that this is going to happen plays a role in like someone's experience of VTS? For example, like I interview and work with a lot of leaders around different industries, but I find that like symptoms of VTS are a little bit more pronounced in people that weren't expecting that to be a part of their job, if that makes sense. So like supervisors who work with their employees and their employees are coming to them with like traumatic experiences or needing to leave because of a death or all of these different things, and they have no idea. They don't know how to deal with that, and that they didn't think that they were ever going to necessarily have to. They're not trained to do that. Whereas at least like in these at-risk ones, like, you know, it's kind of like baked into the job in a way. So I'm just kind of curious your thoughts on that.
I think, if I can clarify that, but I mean, both of these professions, if you kind of dive into the vicarious trauma or secondary traumatic stress research, there are some elements of the idea that being taught in their professional development. So in their schooling experience of some sort, they might be exposed to the idea of how this can impact them. So they're, for probably a good portion of the individuals, they have an awareness, which might be helpful. But in terms of like research comparing more, you know, at-risk populations, there's not a lot of research done comparing to like the general populace. So it's hard to say how much would be attributed to the knowledge of getting into that kind of field. I don't know if I could really expect it. I would agree that, or I would imagine, agree with that idea that they're at less risk of actually adopting it, but on average, they're the ones that are going to be diagnosed with vicarious traumatization more than the populace.
Yeah, that makes sense. I also was thinking, just based off of my own background of like going into psychology, being like, I want to be a clinical psychologist. And then I was like, actually, I don't think I can handle that. I think I'm going to be an IO psychologist because that's way more up my alley. And that's the level of like responsibility and like health and wellness I can get without like taking something fully on. So I wonder how many people have made similar decisions where they're like, I personally don't think that that's like a good profession for me. Anyways.
I mean, that's my dad's best friend was a district attorney in Nashville, and he left the job after he started having to wear a bulletproof vest to work on his way from his house to work because they were worried about getting killed, and because he was being exposed to so many horrific cases, and he had to leave the job because he's just like, I can't.
Yeah.
So I think that these populations are exposed to a lot of really bad stuff that we should be paying more attention to, and that's what my research is hopefully getting at. I thought so. Something interesting. Let's see. So one of the questions that I wanted to ask was because of the sample size being so small and these analyses being pretty basic, like, can we trust the idea that these findings actually represent a true association that's going on in these populations? And is there something actually happening here? This is the question that I asked ChatGPT, so I could show you guys the answer in a second, but I wanted to hear what your thoughts were. Were these findings invalidated by the methods?
I think somewhere you mentioned that there were no confounders, but there is one section, it talked about predictor variables.
Yes, predictors.
So, but it's just not clear how they did they use a very strange name, hierarchical model, but it looks like just a multiple regression model. And it's not clear how they chose the variables to consider for that regression, right? But they seems to be doing some kind of regression, but just not clear how they.
And I can't tell if they're using them, if they're controlling for anything in that regression.
They mentioned the 4 variables, but it's not clear if they considered more and these 4 are the final variables, or they only consider those 4. But why they just chose those 4 variables, it's not clear, right?
Yeah.
Okay.
No, there was little planning in the description of this, or at least there's probably a lot of planning amongst the 2 that wrote this paper, but they didn't really put a lot into the methods section.
How much would we know about confounders for a subject matter like this?
That's a good question.
Well, thinking through it.
There was one study that came out on one of the big studies on lawyer health came out in 2016, a year before this paper came out. So they're pretty limited on knowledge.
And even today, studies are there? What variables have been examined?
Less than 20.
Okay, there's less than 20 studies. So what's the probability the universe of confounders? No.
Well, even the way that they did the analyses would be hard to.
Right, and they don't even measure a bunch of things. All right. And what other, so this is a lesson for everybody, right? That's what the point.
I guess at least they can, in their models, they should consider the gender, age, educational, things like that.
I agree
too.
with that.
But
And
maybe
I'm
not significant.
Right, and I'm gonna pile on first, because I think most of us would say, there's some hints in here too, and this comes to a certain activity you had recently, which you're not done with, which is, but, yeah, anxiety, depression, do you think that those things are significant confounders potentially?
You also factor in before being a lawyer, if they have trauma.
Well, exactly, and you can even tell what kind of trauma it was, right? Because people just says trauma, and I'm like, okay, well,
But
everybody's
when
got
you-
trauma, I mean, who hasn't bumped their head?
When you talk about confounders, you have to be, you have to specify a variable, like a main primary treatment variable. So it confound that relationship. But here, you haven't seen that variable specified, right? So it's more like finding the predictors for the trauma, right? So it's not just confounder, it's more like what are predicting this one when we have other variables present.
Oh, we got some.
Ryan had something. Oh, sorry.
Yeah, I was just like building off what they were saying about like the anxiety and depression. They used like a survey to measure it. In this study, would it have been like less contentious if they'd used like a biological measure, like to measure like kind of stress levels, like I think cortisol does it?
Oh, well, I think for like this sort of a study, you probably want to go with like a clinician diagnosis of depression or anxiety. That's going to be more indicative. That's, kind of the gold standard for psychological research, but
I was
not surprising.
That's a good question, because that's more mechanistic, right? So that's spot on for a mechanistic thing. What Chapman has said talking about is when you try to do these kinds of studies, you usually use a questionnaire-based thing because it's easiest to administer. And you hope that it is close enough to what would happen with a clinical assessment. Okay, and so you just get distinguishing when you write a paper, you say, well, where we made this assumption based on the diagnosis, the outcome that we used.
Can vicarious trauma and personal trauma be separated in different categories? Did they do that? Because I know they talked about this relationship between like history of trauma, of personal trauma, and vicarious trauma, but
So
can they be incorporated? Like, are they being overlapped almost between like personal trauma being rooted in experiencing vicarious?
I think from my interpretation of what they wrote was that they had an item on the survey asking about history of personal trauma and then the impact of that, or like the intrusiveness of that personal trauma. There is research in the vicarious traumatization literature that focuses on, because it was part of the conceptualization of PT and secondary traumatic stress, that history of traumatic experiences can influence the impact of that exposure. There is kind of varying levels of relationship that the literature has found, so it's not super clear. But at least for the purposes of this, I think that it appears that they measured it separately. And then in the predictive model, that's where they go.
Yeah, the data is kind of mixed on that. There's everything from no relationship between personal trauma and vicarious traumatization and a multiplicative relationship between the two. And that really depends on the individual. And so that's why once you get to see something like this, the next step is you got to get clinicians involved and you've got to get an actual diagnosis versus a non-diagnosis versus, so in this case, we have a measure on a survey. A measure on a survey can tell you, maybe you should go talk to somebody, right? But it's not gonna tell you whether you actually have a clinical level issue that needs, meds or cognitive behavioral therapy, CBT, or other things of that nature. So it's, yeah, humans are complicated. I wish it was, if you have personal trauma and you're exposed to this thing, you're gonna have vicarious trauma. I wish you could say that, but unfortunately, they've seen everything from nothing to, like I said, a multiplicative type of relationship between the two.
Absolutely. What did Dr. Wilson say?
His is more about a comment about sample size. He says adequacy of sample involves several dimensions, including representativeness and also magnitude of effect size a sample can detect. A small sample can be both representative and fully sufficient for detecting moderate to large effects. Model complexity and degrees of freedom can eat away at power. And then sufficiency of samples to detect effects of certain magnitudes.
And for the primary analysis, it showed they at least claimed a large effect. It's like 0.9 for that. It's an independent sample t-test for the mean difference of vicarious scales. So that would indicate that there is at least a higher, or there's more concern of vicarious trauma in lawyers than mental health professionals. So this is what ChatGPT said. It said, we can believe that the observed differences exist in this sample, that they are plausible and theoretically consistent with prior work. So kept it pretty vague, but it was saying that you can at least take the main take away message from this research.
Yeah, that is just in this sample. I love how ChatGPT actually used the right words here, which is in this sample.
I know,
Because
I
it
was
said,
really
Believe the
surprised.
differences and left it there exist, period. Then I'd be like, well, ChatGPT isn't a scientist, so that's okay.
It did, well, and it did, there were other parts of the prompt that I didn't include here. It said, what we cannot assume, or one of the things that you cannot assume is that being a lawyer causes vicarious traumatization. I was like, that's not something that I think anybody at this level would ever consider. But in the model, it was like kind of figure out if being a lawyer could potentially cause having vicarious trauma, which is pretty funny. All righty, that's my time. Thank you.